The statement, the committee should appraise the Senate on the status and welfare of baby Junior Sagini, indicating measures the government has taken in ensuring adequate provision of all his basic needs. 2, state mechanisms, if any, that the government has put in place to ensure effective and efficient response to reported cases of child abuse, neglect, and violence at county and sub-county levels. 3, outline the plans, if any, that the government has put in place to provide for specially trained and designated public prosecutors to handle cases of child abuse and in ensuring the child protection centers are managed by trained counselors. 4, shed light on the loopholes and challenges affecting the realization and implementation of comprehensive child protection services in Kenya. And finally, recommend measures that can be adopted to increase public awareness and sensitization on the widespread challenge of child abuse, neglect, and violence in Kenya. My other statement, Mr. Speaker, I also rise pursuant to Standing Order 52.1 to make a statement on the issue of general topical concern, namely the state of child protection services in Kenya and the manner in which child abuse cases are being reported and handled. Mr. Speaker, sir, according to a new national study conducted by the Ministry of Labor and Social Protection, 1 in 2 young adults in Kenya experienced violence as a child, whether physical, sexual, or emotional. One example that stood out recently is the very sad and unfortunate case of Baby Sagini, an innocent 3-year-old boy who was left blind after his close relatives gouged out his eyes. It then begs the question, what's the problem and where is the help for those vulnerable children that so desperately need it? Mr. Speaker, sir, Article 53(1)(d) of the Constitution states that